Cafe, where the take shape, thoughts find path, and every conversation explores the art of thinking beyond the obvious. And today I have my special guest. She's a board certified internist and a founder of Celestic MD, no other than Dr. Widian Jubair.
Hi. Thank you
Welcome.
for having me today.
Welcome, Dr. Widian on Abstract Saying. Can you please introduce more about yourself that I miss?
Yeah, I'm Widian Jubair, an internal medicine physician and wellness advocate. I'm also a mother, an ex-scientist, an entrepreneur, and the founder of Celestique MD, a concierge internal medicine clinic in a beautiful Colorado.
Yes, and thank you so much for sharing your knowledge and wisdom to the world.
My
Dr.
pleasure.
Widian, yes, thank you. And today let's talk about bridging science and wellness, the future of internal medicine. So tell us, the term wellness can feel vague in clinical setting. How do you operationally define wellness in the context of internal medicine? With what specific measurable outcomes are you looking for beyond absence of disease?
Yeah, absolutely. So, wellness is simply a state of a proactive biological and psychological optimization measurable through objective clinical metrics in addition to patient reported outcomes. It is not just feeling good, it is a quantifiable measure. There is many ways to quantify wellness. A common one we use in internal medicine is metabolic health. And what that means is an optimal glucose control, cholesterol control, or body composition optimization. Um, Another way or objective clinical metrics we use to measure wellness with is inflammatory markers. So low or undetectable levels of key inflammatory biomarkers like C-reactive protein is often a great reflective of wellness. um, Also, there is a lot of psychological resilience validated score measuring of stress, anxiety, perceived quality of life that we often use as a clinical metrics of wellness.
Clinical matrix indeed. And doctor, what is the single biggest structural or cultural barrier preventing the traditional sick care model from evolving into a true well-care system, and how do we overcome it?
Great question, and I'm glad you asked because I think the current status of internal medicine and the single biggest failure we have on the current traditional model of healthcare is the focus on disease management rather than health creation. Our current system excels at crisis intervention, but it often waits too long for a condition to become chronic and symptomatic before fully treating it. This approach misses a opportunity for prevention and optimization that often exists in the pre-disease or early stage phase. Now, trying to introduce wellness to the traditional healthcare model, as I said, wellness is a measurable metric. It's not just feeling good. There is a tremendous amount of research that's showing evidence-based wellness. A study in the 2021, just a recent one, using U.S. health and retirement data, showed that people who live a balanced life with purpose had the 24% lower chance of becoming physically inactive, 33% lower likelihood of developing sleep issues, and the 22% lower risk of becoming overweight. But that's been said, back to your question, the greatest barrier currently preventing the effective integration of wellness practices into our data driven decision making internal medicine is the silo of status quo. We have the financial and structural inertia. The current system is perfected and designed to perpetuate reactionary sick care because that is where the financial incentive lies. I've worked in multiple conventional healthcare systems, and I know the science is there, but the systemic willingness to disturb this status quo, unfortunately, is lacking. And this is precisely why I founded Celestic MD. I wanted to demonstrate that there is a viable, devoted alternative to the current reactive healthcare system that we have.
Interesting, Dr. Widian. And how does the role of intermists change when the goals shift from just diagnosing and treating illness to activity, co-creating lifelong wellness plan with patient?
Yeah, I mean, this is an amazing area of development, and I think we at Celestic MD try every day to bridge the science of medicine with the science of wellness. For example, we use quantifiable metrics to show patients how they can incorporate wellness into their daily life and how that would help them. For example, we have a 10-week mindfulness program, and studies had shown that it reduced inflammatory markers and cytokines. We also frame our discussion with our patients about lifestyle changes as potent therapeutic agents. So, um, for example, there is studies about Mediterranean diet. Um, Doing Mediterranean diets as a lifestyle change have a greater number needed to treat, which is a measure we use often in medicine to um, justify success of a treatment versus the other. And we found that study found that the implementing Mediterranean diet for cardiovascular events have a better or similar outcome to several common medications we prescribe. We also like to bring the newest studies about metabolomics and epigenetics that show how environmental and lifestyle inputs directly modify gene expression and metabolic pathways, and linking those small changes to big biological outcomes. But the one thing I take pride of at Celestic MD, and I am dreaming of a future where this become the new model of health, is patient empowerment. So the single most important action item for a patient who is seen in our clinic is to transition them from being a passive recipient of care to an active co-pilot in their own health journey. This empowerment starts with reviewing their daily life choices, what they eat, how they sleep, how they react to stress. And then we discuss those as a powerful medical interventions that could um, critically change their life more than any average prescription medication. Of course, this being said, it requires asking more questions, spending longer time with patients, understanding the full picture and the full history, and then creating a personalized root cause analysis of what's going on with their health rather than just symptom management.
Dr. Vedon, in a system often driven by 15-minute appointments,
Mhm.
how can we realistically integrate proactive wellness strategies like nutrition counseling, stress management, and step hygiene into standard practice?
Yeah, great question. Unfortunately, I don't think 15 minutes appointment is enough to address any of that. So the way I foresee the solution in the future is to replace the healthcare system that's currently reliant heavily on fee for service model which rewards volume, more tests, more procedures, more visits, and replace that by transitioning fully to personalized medicine and focusing on health outcome, where we are financially incentivizing providers to use low cost, high impact prevention strategies like lifestyle coaching, nutrition counseling, group education, and other methods to lead a better longer term outcome that's often less expensive than pharmaceutical or hospital intervention. And to be honest, the cost of a year of continuous health coaching is negotiable compared to a single procedure in the hospital or a week stay in the intensive care unit for a health issue happening due to us falling short from providing um, an outcome based health solutions.
We are seeing an explosion of health data from wearables and genetic testing. How is the future internet supposed to synthesize this flood of information into actionable, personalized wellness plans without causing a patient anxiety?
Yeah, that's a great question. I think providing a good education and when providers act like their patient's health coach, um, helping them navigate their health journey, using all these advances of AI and all these biohacking uh, metrics we are using. Um, so being a good physician means you sit with your patient, you take a full history, you understand their health needs, and then we can incorporate all these advancements in technology to help guide us personalize the care for each patient rather than trying to find one size fits all and trying to treat every patient with the same thing. So I think it is definitely needs a big paradigm shift. We need to start by showing systemic empathy. We mandate that every clinic or any healthcare care system is structured genuinely to make a patient feel seen and heard, not just triaged. And then we can integrate all these metrics to move beyond just measuring blood pressure and cholesterol to really look at the full picture and add the wellness part and the purposeful fulfillment and show that the holistic approach to medicine and prove that the healing of the body, soul, and mind is the most effective medicine rather than um, thinking of there is an ache, here is a pill, and let's see you in 3 months, which pretty much what we've been doing in traditional healthcare right now.
What is the most promising emerging technology like AI, diagnostics, or microbiome analysis, or epigenetic testing that you believe will have the greatest impact on bridging science and wellness in the next decade?
I think metabolomics are the most exciting for a simple reason. It is very personalized, and basically, the hope is we have metabolomics or microbiomics signature of a person, and that guide us to know what are the conditions they are at risk for, what's the best treatment we can treat them with. The research is fascinating and it is becoming very big and well funded, and we are seeing hundreds of studies coming out every year. So I think that is one of the, probably because I'm interested in personalized medicine, but I think it is the most promising technology we have in hand right now that I can see changing people's life, helping diagnosing conditions early, preventing conditions, and choosing the best treatment if we are to treat a patient because that is basically your as important as our genetics signature. I think our microbiome and metabolome signature is the next most important advancement we have in the last decade.
Dr. Widian, as a board certified intern and a founder, what are your short term and long term goals?
So short term, I am excited to build this program where patients feel they are partners in their health and help them understand how big lifestyle is into any pathology of any disease. Um, and then I think the long term is hoping to see this model becoming more dominant and the model that we see often rather than, as of now, the personalized care or holistic care or concierge internal medicine are very small type of practice, and a lot of patients ask, what does that even mean? So my short-term goal is to make this model happen and make patients feel they are taken care of the way they needed. And my long-term goal is that this model become well known and appreciated, that patients start demanding to have that type of care over the traditional 15 minutes visits, uh, quantity over quality type of care that we are seeing right now.
Good luck to your goals, Dr. Widian, and looking forward for more success. And
Thank you.
what will be your piece of advice for those people out there want to be like you?
For physician who made it through the med school and all the training to help people, and they are burned out in the current healthcare system, my word is don't give up. You've done medicine for the right reason and for the right purpose. So just go find your way. Don't just give up to, oh, that is the only thing I can do, because medicine is, you've done medicine for the right reason, and the rewards are waiting and they totally deserve the pain. um, for new business owners, I never done business, so this is my first experience, and it has its ups and downs. My advice would be, don't doubt yourself and be flexible to learn about the market and learn about what's the needs and how to build your system to attract people and how to help people see the value of what you are doing. Um, and reach out, re- connect and reach out. It is one of the best human qualities that unfortunately we've lost a lot of it in the translation between the age of the internet and now with the AI. Just reach out to people, sit with them, shake hands, look in their eyes, and have a good talk, and you will learn a lot. And good luck with your journey.
Yes, good luck, and thank you for that advice, Dr. Widian. Thank you. And our fee for service system finally or financially rewards procedure over prevention. What changes in healthcare policy or payment models are necessary to make the science and wellness model economically viable and widespread?
I think just changing the way we think, because the um current system is all built about around paying for services that is require procedures and frequent visits and perpetuatory reactionary sick care, while the true health is not reactionary or reactive, it is usually proactive. So to bring value first, like as a systemic empathy and value to treating people to feel better, creating health instead of treating illness. So changing the paradigm to introduce the value of prevention and low cost, high impact prevention strategies. And from the finances standpoint, I think trying to think about how much it costs if someone gets sick and need to be in the hospital compared to how much it costs if we provide longer appointments. So lifestyle coaching become available, nutritional counseling become available, social workers and outreach and group education. All of these strategies won't be as expensive as any procedure, especially done at the hospital. So I think just causing a paradigm shift in what we are doing now, we are not keeping people healthy and we're not giving them the best value of healthcare financially. So I think trying to change this into more personalized care that's focused on the outcome is the way to go.
If you could redesign a medical school curricula from the ground up to prepare doctors for this future, what is one of the subject or skill set that would become a core requirement?
I'm glad you asked. I was thinking of that the other day. I think I've graduated med school a while ago, so not sure what they do now in med school, but I would definitely make a mandatory course of patient history taking and interviewing patients, personalizing the healthcare experience where med students or young doctors or residents are not allowed to sit in a computer and scroll through a screen. They are required to do the visits A to Z by interviewing the patients and the patients really grading them on their human interaction, their eye contact, and their bedside manners. I think we lost a lot of the healing piece of medicine with the introduction of the digital data and electronic medical record system, and now with AI. So I think that course alone would just put this perspective again into um, put healing back into medicine, where you have to shake hand with your patient, you have to look at their eyes, you have to um, like understand what they are talking about, give them the attention, not look at your computer while talking to them. I think that course would be of great value, building up these new doctors, new med students, new healers.
If you could, let's say, what is the most powerful success story you've witnessed? A case where this integrated approach led to a transformative outcome that traditional medicine alone might have missed.
So that's a patient story I always remember, and um, I tell my mentees that too. So there is this lady who is 70 years old, been diabetic for 40 years. Her diabetes has been controlled for the full 40 years. And then over the last year before me seeing her, her blood sugar is just out of control. And the way she was treated, like what we do in traditional healthcare, she was given higher doses of her medications, and then that didn't work, and then they added insulin. And when I saw her, she've already seen 6 providers over the year, and everything was being done is upping her dosing of medications and adding more medications. And the only results we are seeing, her blood sugar is not responding. And I remember like looking at her information, her lab data. I'm like, "This is something not adding up." Like she was controlled for 40 years. She didn't gain weight. Her vitals are all good. It doesn't make sense that her sugar is still fighting us and out of control. So then I see her for the first time. I spend my time with her and I ask her a simple question. What did you do differently in the last year? Or what happened in your life differently in the last year? And she said her husband had died and she felt his absence and she is very lonely in the evening. So she's been eating a pint of ice cream every night to just cope with her sadness, cope with her grief, and with her boredom. So it was not that her pancreas gave up or that she's not taking her medications. I was reading it through previous doctor's notes. A lot of them marked her as non-compliant because that is the only explanation. We are upping her medicine and we are not seeing results. But then all it took is sitting with her, asking her a human question: what changed in your life in the last year? And she said, I just been eating more ice cream because that is the only thing that make me happy since my husband died. And the way we handle that, we told her that's probably the potential reason why her blood sugar is not coming down. We worked with our social worker to arrange her to get signed up to group classes and the grief groups on Facebook and help her, support her in her coping journey and grieving journey. And then I told her, you know what? I'm not increasing your medicine today. I want to see you in 3 months, but I want you to promise me not to eat ice cream and we'll work in your feeling bored and lonely. And then, sure enough, 3 months later, her blood sugar was back under control. So it is not a life changing story, but to me it is, because how small it is of an effort you can miss, and that is just becoming not really healing a patient or helping them achieving their health goal or even giving them a good health care.
Okay, Dr. Widian, before we wrap up our discussion for today, I'm inviting you to please do listen to my other podcast, people, because my abstract essay is already in fifth season. Abstract Poetry in second season, and my Book 101 review in fifth season too. Comedy 101 in second season. I'm a Food 101 in fifth season as well. Geography 101, Love Letters, Movie 101, and Music 101 are in fourth season. And Science 101, Sex 101 in second season. And my baby podcast, Law 101, Mental Health 101, and Bible Verses 101. Please listen to them wherever you listen your podcast. So, Dr. Widian, tell us, for your colleagues in traditional internal medicine practices who are skeptical but curious, what is the first most accessible step they can take to begin bridging science and wellness in their own practice tomorrow?
I would say keep an open mind. We weren't taught much about wellness in med school or even in the training, but there is an overwhelming body of knowledge and data behind how wellness is helping people, making them live longer, happier, healthier. So just keep an open mind. I know it is there's some one of the subjects we are not taught well in med school. Go out of your way, sign up for courses, learn in your own. I've done a course with Harvard Medical School about lifestyle medicine and culinary medicine and how to use medicine as food. And I think Harvard Medical School doesn't need an introduction. So if Harvard Medical School believe in it and have enough data to make an education course for physician about it, everyone should reach out, get out of their bubble of insurance covering this and traditional healthcare saying that, and just go out of your way. Continue pursuing your knowledge because you are a doctor and a healer, and healing is a process that just evolve and get better and get refined over time. It doesn't stop after we finish schooling or training.
Well, Dr. Ouijan, thank you so much for sharing your knowledge and wisdom to the world. Hoping for more and more empowering advocacy to come. So, can you please invite our listeners to support your advocacy, your projects, or anything you want to promote on Abstract Essay?
Yeah, I would love to for people to visit my website. We have education blogs, We talk about the different treatment models we do. We also post weekly an educational post on our Facebook page and an Instagram page. We are trying to empower patients with education and knowledge. So, yeah, please visit our page, visit our website, and I would love to talk to anyone who's interested in knowing more about wellness and how the science of internal medicine could meet with wellness for a better, more effective type of medicine.
Yes, people, let's support Dr. Widian Jubair because if you support her for sure, more and more empowering advocacy to come. So, Dr. Widian, thank you so much for your time.
Thank you for having me today. I appreciate your time.
More to come, people. See you soon.